Hello everyone, my name is Qian Luo and I'm a Ph.D. candidate from NC State University. My advisors are Dr. Jeremiah Johnson and Dr. Fernando Garcia Menendez. Today, I will talk about the project I have been working on during the Duke Data Analytics Fellowship, reducing power sector emissions in China for climate and public health benefits with economic dispatch. With its rapid economic growth, China has become the largest electricity generator and consumer in the world, accounting for more than 25% of both global generation and consumption. Coal is still the dominant fossil fuel, with more than 55% of total generating capacity and almost 40% of CO2 emissions coming from the power sector. Several studies have quantified the impact of power generation emissions on human health, estimating 200,000 to 500,000 annual premature deaths associated with PM 2.5 exposure attributable to power plant emissions. The power system in China is highly regulated, and it uses an eco-share dispatch system, which means that the power plants using similar fuels and technologies will run similar hours in a year. It sounds fair, but makes the system less efficient and less secure. To address these issues, the power market in China is going to adopt economic dispatch, where power plants with higher efficiency generating cheaper electricity will generate more. Given the significant amount of power plant emissions, it's worthwhile to investigate how this transition will affect emissions, air quality, climate, and public health. One step further, another research question is, can we include the emission externalities during economic dispatch to help mitigate negative impacts on climate and public health? Let's look at economic dispatch first, when only real costs of electricity generation are considered. As more efficient power plants run more hours, power plants in the west and north generate less electricity, leading to less emissions and associated premature death. In total, annual mortalities decreased by 3,000 deaths when comparing with EcoShare, when the total mortality is about 170,000 deaths per year. But mortalities increased in eastern China. On the other hand, carbon emission increased by 10% because more electricity is generated from coal after economic dispatch due to the high prices of natural gas. To answer the second question about internalizing emission externalities, I designed another three scenarios. CP40-80 means including carbon price at $40 and $80 per ton of CO2 emissions, and HD is including health damages during economic dispatch. The left chart shows the variable costs with and without carbon costs. Under economic dispatch, variable costs of coal are much lower than gas, and even when carbon costs are considered, most of coal plants are cheaper than gas. Only when the high carbon cost at $80 per ton is used, several coal-fired power plants have higher variable costs than gas. The right map shows the distribution of marginal damage costs of SO2, which vary greatly by location, leading to a more varying variable cost for each power plant. We find that considering two types of emission externalities leads to different results in total number and distribution of carbon emissions and avoided mortalities. When including carbon impacts in electricity dispatch, total mortalities slightly increase and most public health benefits happen in the middle and northern part of China. When including SO2 health impacts, 30% of mortalities from power plants emissions can be avoided compared with the economic dispatch, but most of the benefits are concentrated in eastern China, where the marginal damages are high. As a summary here, the results so far suggest that adopting economic dispatch will have impacts on both carbon emissions and air pollution caused by the power sector in China, especially the distribution of those impacts. Only considering the impact on climate may lead to negative impacts on public health, while only considering public health may not help much in reducing carbon emissions. It's important to take both climate and public health into account when implementing any policy targeting at the power sector. That would be all of this work. Thank you for listening. Also, thank Dr. Zhang Bao for his interest and willingness to engage on this project. If you have any question about my work, please contact me at this email address. Thank you.